So a lot of people have been telling me to look at certain celebrities' faces. Maybe it's more like Ozempic use. Do I want it normalized for kids? No, I feel like there's an appropriate age for all that.
Lorry Hill is an amazing YouTuber. She's one of the OGs of celebrity plastic surgery analysis. She has a keen eye for aesthetics and beauty. She does a great job of destigmatizing plastic surgery with kindness and compassion. And she's always up on the latest plastic surgery trends. It was an honor to sit down with my friend Lori and to chat all things plastic surgery. This podcast is sponsored by the Feel Confident brand. For the best in skincare and hair care, make sure to check out the products at feelconfident.com. So is there still stigma associated with getting plastic surgery?
Yeah, of course. I mean, I feel like we all feel it, from like the plastic surgeon who doesn't necessarily want to be super open about what type of doctor they are. I've heard that before. I think actually I've heard that from some of my friends that are surgeons, that they feel like it's less, I don't know if the word is altruistic, or like it just doesn't sound very benevolent to say you are a plastic surgeon, when really it can be something amazing for people and life-changing. But also down to like just regular people, like we still get a lot of questions about wanting a change. We still all feel like it's about vanity only.
Mm-hmm. Yeah, I mean, should people be thinking about plastic surgery like in a different way? Like, should we change our perspective, you think, more, or?
I think that whatever you feel is okay, like just in general, it's okay to feel what you feel.
Yeah, I think like with some of the celebrity, work that we do with the analysis and all of that, I mean, should celebrities be doing more to normalize the process of getting plastic surgery?
I think this is going to sound strange given like what we do, but I think that if they were just a bit more honest, rather than being like, hey, this is me before my nose job, this is me after, but more like, hey, I do look younger, or I know you guys think I look younger, but I've had a little help. Just like that one line would help so many people.
Right. Yeah. Like sometimes they're willing to reveal a little bit about what went on, but like not the big picture. Like it's just a small little taste of potentially the procedures that were done. I've noticed that as a trend where it's like, oh, look, but this person's now being honest, but like they had many more things that you and I know that went on, but they're just talking about a small fraction of it.
Yeah. Why do you think that is, by the way?
I mean, I still think that they're uncomfortable like revealing it all. They don't want to be judged for being too plastic or too fake. So they give people just like an inkling of it, something that is just so obvious that it's like, of course they had that done, but they're, then they claim that they're being honest, that they told the truth. And then people buy it and they say, oh yeah. And then they feel like maybe they're not going to be bothered, by any other like comments, or, no one's going to be like, oh, and what else, because it's like, okay, well, that's, I guess, what it was.
Yeah.
It was just a nose job.
Yeah.
And what about the rise of like social media and like influencers who are more open about, work they may have had done? Is that changing the atmosphere a bit, you think?
I think so. I think every little bit helps. I do think like a lot of influencers are more open because then they get the procedure for like a discount or for free. So they kind of have to be open, whereas the celebrity is paying for anonymity.
Yeah. And is that a good thing though, that like people are now, being told that like, oh, like this person's having this surgery, this person's having that surgery? Like, is normalizing plastic surgery a good thing at the end of the day? I guess is something to, that I've been thinking about, like knowing that, your favorite, not maybe celebrity, but your favorite influencer had something done. Is that overall like a good thing for society? Like does that make people feel like they now have to go and chase that type of procedure?
I think it's hard when we talk about normalization, because like, what do we mean exactly by normalized? Do we mean like it's a regular everyday thing? Like you hear about people talking about it just at the bus stop or at the water cooler, or I guess it depends what you mean by normalizing.
Like accepted by society. Where like you can say like, oh, I had this procedure, and people won't think twice about it, be like, oh yeah, that's cool. Like I had that
Yeah.
too. Just kind of like getting, I don't know, a new pair of pants or something, with like a certain
Yeah.
brand. It's like, yeah, I have that too. Or like, oh, that's great. Like, I hope you're happy.
Oh gosh, I don't know. The way you make it sound though, it sounds really nice. It sounds like it's like a world of no judgment. So that's good. But then like, do I want it normalized for kids? No. I feel like there's an appropriate age for all that.
Yeah. So, but like a lot of the social media stuff, people are being exposed to much younger nowadays.
Yeah.
So I feel like there's I don't know, there's potential for problems there. If someone's
Yeah.
much younger and they're seeing that like, their favorite celebrity or again, just an influencer had something done and now they feel like maybe, they're still young, but like maybe it's time for them to like do that because then that person's looking really good. So I don't know. I think there's potential for a downside, even though they're being really honest. Like they're saying like, look, and they're showing maybe their journey and clips of them
Yeah.
having the procedure. So it's like we know that they actually had it done, and it's great that they're being so honest. But is that influencing now people to get stuff done much younger?
I know. It might be. It honestly might be. I guess we don't know the answer to that. I do think in general, people who talk about their procedures and they're honest, I just wish they would be more honest about the cons. Like, oh my gosh, this hurts so bad. Like for my facelift journey, I did a facelift journey video and I talked about how bad the pain was and how uncomfortable I was. And a lot of people said that part alone made them reconsider even getting it.
Yeah, the downsides of the procedures are often underrepresented.
Yeah.
I agree with you. Yeah, and I wanted to ask you about that because you've been like super honest about some of the procedures you've had and, just, those journeys. Like, what has been sort of the most surprising for you kind of going through the different surgeries?
As far as downsides.
Yeah, downsides and or just like something you didn't expect would be the case, and then
Yeah, I think probably necrosis. Getting necrosis was something really unexpected and that it was in the hands of a really experienced surgeon. And that really showed me that anything can happen with surgery.
yeah, I think that's absolutely true. That even in the best hands, and most skilled people still get complications, and
Yeah.
we say on the surgical side that like the only people without complications are the ones not doing enough surgery.
Yeah.
The more you do, the more you see. And certainly certain procedures carry just more risk, more general risk of bad things happening. And I think, people need to understand that could happen to them,
Yeah.
and like, even though patients will sign all these forms, and they'll say like, oh yeah, like I accept this risk, I accept that risk. When it actually happens to them, they're oftentimes not as accepting,
Right.
and they think that for some reason the surgeon messed up or like maybe, I don't know, the surgeon didn't like them or something like that.
Yeah.
They start turning it. So I don't know how to remedy that other than just kind of really explaining it as much as you can. But, in a consultation, you have limited time. You can't explain every single possible complication under the sun.
Yeah.
So you hope that people are educated enough with just like the basics and that they've actually read the forms. But you can't be completely sure of that, even if they're just signing, because a lot of people, they don't read the paperwork.
True. I think the best way, a surgeon can remedy that is, prior to the experience, to the procedure, they can say, I've never had, for example, necrosis happen, but it happened to a surgeon friend of mine, and these were the circumstances, and it was just something that happened. So you should know that this isn't that rare. I have heard of it happening. On the flip side, you can also say, if it does happen, be really there for the patient. I've heard of so many patients being written off by the doctor as if it's their fault that they had complications.
Yeah, no, of course, for sure. I think on the side of just like informing patients in advance of like potential complications, totally, for that, it's just that there's so many things that can happen, and I think like if you really wanted to run through each of those things, it would probably take you hours with each patient. And then the question is like, are you then going to be scaring people away? Because a
Yeah.
lot of other people will not be. And also it's just not always the most practical time, time to invest into, the practice when, like, I don't know anyone spending, hours and hours just explaining risk
Yeah.
preoperatively. Um, and then and then the patient might feel like, hey, like, well, maybe with this doctor, these are the risks, but
Right.
if someone else who didn't mention
Yeah.
those things, it seems like it's much safer in their hands. And then, jump ship even after you've allocated all this time to explaining it. So there's a balance there between like
True.
revealing enough, but also not having that take up half your day.
True. And I wouldn't say like you need to run down all of the complications, but I think if somebody asks specifically about necrosis, because I know that's like a common, at least somewhat common question that, for example, like tertiary rhinoplasty patients will ask.
Mm-hmm.
I almost feel like that should, like, there should be more time spent with that. Does that make sense?
Yeah, I mean, I think if it's a specific
Yeah.
ask, like, oh, sometimes people ask me like, what's the worst thing you've seen? I think that's
Yeah.
a fair question. Like, what's the worst thing that could happen? That kind of thing. Then I think, yeah, I mean, look, I think you have to always be honest, and you have to
True.
answer the actual question. But I have had patients ask me like, what are all the risks of this procedure? And I
Right.
said, look, that's in the forms that you sign. There's lots of them.
Yeah.
So if you have any specific questions, and I tell them the most common things that could happen, and I'm happy to tell them the worst thing I've seen. But I think it's just, yeah, it's finding that balance. You don't want to play it. You don't want to play it off like nothing bad could happen, but then going through every possible complication can just take literally all day.
That's true. And then, I mean, also just being a very likable and there for you type of personality works really well. Like someone once said, I forgot who this was, but they were like, nobody sues anyone that they like, So if they like you, that goes really far in not having, further legal issues if something goes wrong.
Yeah, for sure. I mean, there's definitely like the legal side of things, but even before that, I mean, you just want like happy patients,
True,
like you just want
definitely.
happy patients. And I think a lot of it boils down to trust, and
Yeah.
it's like, yeah, it's likability, but it's really, I think, very much about trust, because there's some surgeons that might be a little harder to like, but like they still garner trust because of maybe their track record or
Yeah.
like, the quality of their work overall. And I think on the patient side, at some point you have to sort of give in to like the process. Like you pick a doctor, you pick a procedure, and if you really want that done, you have to accept that there's risk and that you're just going to accept it and go for it. And you can't control every little thing that happens.
True.
And I find that some people find it harder to trust, and,
True.
and sometimes it seems like they trust you early on, maybe before the surgery, but then afterwards, if they're not happy about something, if that trust goes away,
Yeah.
it's very difficult. It can be very difficult to continue like complete open line of communication. And because, my thinking is, if you trusted me enough to do the surgery, like trust me to take care of you after.
True.
And
yeah.
when that trust goes away, it's very difficult to work with that person. What I always tell people, and what I just tell myself, is that like when I look back, it's now been 6 years in my own practice. Like when I've had, and I mostly have very reasonable people, like I've never had any problems like working something out. Like if the result wasn't, perfect, wasn't exactly to their
Right.
liking, we figured it out.
Yeah.
But when you have unreasonable people, and nowadays I try to spot that in advance, it becomes very difficult to, to work with them afterwards, because it might be that something that they're unhappy with was something that could have been completely predicted in advance, just with like, as the product of the surgery, not even a complication, but like, hey, this is what happens with so-and-so procedure. So it's tough. So what I've done over the years is kind of slowed the process down a little bit. So I still start with video consultations often, but more and more I sort of force the in-person, whenever I'm not sure
Yeah.
about a person, not just their anatomy, but like personality,
Yeah.
to just make sure that it's the right fit.
Right.
Because, once you get burned once or twice, it's just, because I feel like as long as someone truly understands what they're getting themselves into, like things just work out. And when they don't completely get it, that's when you can run into problems. So
That makes
slowing it
sense.
down, talking to them more, having a couple of sessions, before they sign up has been a great adjustment, at
Yeah.
least for me. And then just wanted to talk about like current trends in plastic
Hmm.
surgery and
Yeah.
what you find sort of to be the most interesting now, and maybe even some concerning trends.
So I feel like we're seeing still a lot of pulled up eye corners and like the look of foxy eyes still. What do you think? Have you been seeing that a lot?
Yeah, I mean, for sure. I think people
Yeah.
looking a bit overpulled laterally.
Overpulled. Yeah.
Yeah, I think so.
Yeah. And so I find it interesting. I actually went to see a plastic surgeon about a possible procedure to like rejuvenate my eyes and my eyebrows. And this surgeon, he's an oculoplast, and they made it very clear he and his I believe it's his fellow, they both said, we are not a fan of the foxy eyes. So if you're here for that, we don't do that. And this is somebody who's like very well respected, who does eyes mainly. All they do is eyes. So they consider that look kind of like not preferable. What would be the word? Kind of like not
Mhm.
an ideal outcome. But then the rest of like the general IG, Instagram, TikTok public thinks it's ideal. So I think it's weird that there's such polarizing opinions about this procedure. Like from a medical point of view or from a surgeon's aesthetic, it's not their aesthetic.
Yeah, that's interesting. When it comes to hair surgery, there's something similar in that, like some
Mm.
places, they'll offer you a very like low hairline,
Mm.
and some people online like they love that. They think it looks so great that all of a sudden you got this like low
Yeah.
hairline, but it doesn't look natural, especially when someone's thinning further back.
Yeah.
So over time, it just like doesn't work for people. Like it might look cool for a few years, and then people start to thin, or they have this like strong bar of hair and there's like not
Hmm.
much behind it. It looks unnatural. So
Yeah.
so it's like, why is it that online, yeah, some people seem to love that look and they
Hmm.
applaud it. Someone posted before and after, it's like, oh yeah, look at that hairline. But then, like, as a transplant surgeon, it's like it's not ideal, or what most people prefer, especially as they age. And maybe
Yeah.
that's what it is. Maybe people aren't like having that foresight, and maybe they're like, maybe for the now it would look great, but then when they're 50, 10, 15, 20 years
Hmm.
out,
Yeah.
it will look rather odd.
Yeah. Yeah. I think people aren't really thinking ahead. And I also think like a lot of these surgical procedures look good with like a filter or just static, but not in dynamic kind of movement situations. For example, I think like foxy eyes can make somebody look kind of mean personally. Um, Not the kind that are like natural foxy eyes, obviously, not people with that natural feature, but sometimes that look, when it's done to somebody, gives them kind of a closed eyed, kind of not sneer, but glare. So it's interesting. I think it just kind of looks good in photos more than anything else.
Yeah, but when you see some of these models, like they're not necessarily always smiling. I feel like
Yeah.
I feel like it's almost like that kind of angrier,
Hmm.
sort of like, you don't mess with me type
Yeah.
of appearance
Yeah.
that seems to be attractive to some. Personally, I'm more, I think, attracted to people who are just friendlier and
Yeah.
warm, but it maybe is not like that for a lot of other people. So yeah, for sure, it's almost like what comes first? Is it more the mood that you're feeling, and then how you want to portray that with your appearance, or is it
Hmm.
like the appearance that's then giving off a certain vibe, about the
Right.
person?
Yeah.
They kind of go hand in hand in some
Yeah.
ways.
That's true. Let's see what other kinds of trends. There's for sure for so long we've had like, the lip lift trend.
Mm.
We've had it for a really long time. Like I had a lip lift it's been almost 20 years now. So it's not like it's something new,
Mhm.
but it still really is a thing, to have as small of a distance between your nose and upper lip as possible. And I know it's not necessarily ideal. But that seems to be what people think is ideal. But like I learned this a while ago from, I believe he's out of practice now, Dr. Stephen Hoffman. He said that the space between your nose and your upper lip should be equal to the space right here. So, I mean, some people just have a bigger space there and some don't, you know? And I found that that's almost across the board looks good on everyone.
Yeah, yeah. Yeah, some people ask me, like, about that ideal length, you know, and I just tell them, like, "Don't worry about the
Yeah.
numbers," is my latest
Yeah.
reaction to that. I'm like, "It just has to work with your face." And, I mean, I do feel like there is, like, the most common range, you know, that I will remove skin, within a certain range for, like, most people, either even if they're starting with, like, a really long distance. Because after a certain point, like, it becomes quite distorting, you know, and
Yeah.
if you try to chase a specific number, you
Yeah.
know? But yeah, I mean, again, going back to, like, kind of models and, you know, I don't look through tons of magazines all the time, but when I see a billboard or I see, like, you know, like a hot new celebrity that everyone's into, man or woman, I do find that they tend to have shorter philtrums and they tend to
Mm-hmm.
have upper tooth show
Right.
when they're parting their lips. So and I don't think that, like, they're not all going and getting lip lifts, but I
Right.
think
Right.
they naturally have that look,
Mm-hmm.
um, and it seems to be preferred by many. But it's not like everyone's a candidate for a lip lift. I think one of the biggest issues with a lip lift is the increased arching of the upper lip. So some
Mm-hmm.
people already have quite a bit of arching. At least that's what I'm noticing,
Yes.
you know, as I do, you know, more and more of these. But when someone starts off with quite a bit of arch, it can be, again, a bit of a distortion to
Yeah.
their face. So I look at that much more than I used to. You know, I used to think, yeah, about the distances and the tooth show. But now I kind of zoom out and look at the overall vermilion border and the arch that they have before the surgery. And if they already have that accentuated arch, even if it's a longer distance,
Mm-hmm.
I'll often advise against it, especially if they're a little older and they have, like, you know, deeper, like, marionette lines and the oral
Right.
commissures are more
Yeah.
indented because it can give you a more of like a frowny type of
Yeah.
appearance. So that to me is one of the biggest reasons nowadays, at least, to not do a lip lift, for example.
Yeah. And I also think it's important, like when you were saying about models, that you see it, you see it on models having a shorter philtrum. Like we also have to talk about, and I think it's actually a bigger deal, is that their dental facial development is different. There's a reason why they're showing so much upper tooth show, and it's not always to do with the lip. A lot of people, I'm sure, come to you and they're like, I want more upper tooth show. Well, if they don't have that developed maxilla, at least to a certain extent, they're not going to get that even with an upper lip lift
Yeah.
unless it's a distorting one,
Yeah.
which you don't do.
Right. Yeah, for sure. And that's also why I've made it a requirement now for people to do in-person consultations after the video for lip surgery specifically, because I want to see for myself, are we going to get to the upper teeth with, like, a safe excision? And oftentimes we can't, and I tell them that,
Right.
and they might get disappointed, but it's better to know that before they show up for the day of the surgery and then figure it out or afterwards. But yeah, absolutely. I mean, the bony structure is so important and has major, ramifications for how, like, the skin looks and soft tissue and all of that. And that's also one of the big reasons why so much changes as we age, is like that bony structure. And oftentimes that's not addressed with different surgeries, it's because the
Yeah,
bone's changing.
absolutely. Absolutely. I feel like we have yet to address like the involution of bone and everything that happens there.
Yeah, and maybe there will be some, I don't know, new, like, exosomes or something that will allow the
Exosomes, yeah.
bone to grow back more, or
Yeah.
to reverse that aging of the bone. I mean, that would be really interesting.
And something
We'll
that
see.
people can do, sorry to like cut you off, but it's like, I just want to remind everybody, as a former dental hygienist, please floss your teeth daily because it helps you to not lose periodontal bone. Like that is one thing you can do, is floss and address that area. That's like a small thing you can do to not lose, bone on both your upper and lower jaw.
It's a great reminder.
Yeah.
Yeah. Something as basic as that
Yeah.
like a lot of people still don't do.
Yeah, most, yeah.
It's really important. Yeah, people don't often think about the teeth as having like a lot of like cosmetic, kind
Yeah.
of changes that can occur to the overall face. Yeah, for sure. What about people? I mean, now that we're on the topic of teeth, I mean, I
Yeah.
don't know that much about this, but like people getting their teeth kind of shaved down, like, is that
For
something that,
veneers.
yeah, for veneers, is that something that's still being done or?
Yeah, I think that it's being done, and it's a lot of what you see is just it's being overdone. And it's so sad because teeth are so important. And when you have nice teeth and then they're shaved down for veneer preparation, it just breaks my heart a little. There are still veneers you can get that are you don't have to do as much shaving down, but you're still shaving. And so that means forever although I have heard with like lumineers, they do minimal shaving, so you may be able to get away with taking them off one day and not putting anything else on. If you have good teeth, just don't do veneers. And I say this as, somebody whose husband is a dentist, a cosmetic one at that. But we both agree it's just better to be conservative because once you put on those veneers in your 20s, that's it. You have them for the rest of your life. You're changing them out generally every, decade or so.
Yeah, that's a great point. Lori, well, I wanted to get your thoughts on like non-surgical procedures. There's all types of different gadgets and
Yeah.
devices out there and all the injectables. What do you feel actually works and what do you think is like total waste of time?
Okay, so I think what actually works is a great injector who can inject. Usually it's a hyaluronic filler and can inject close to the bone. They know what this means. You don't need to know what this means. One who can do that and who can effectively scrape the bone as they're injecting, that's the most effective type of injection that can stave off other bigger procedures for quite a few years. Those type of injectors are usually booked 6 months out. I mean, the one in my town, who I think does a flawless injection, she's booked 6 months in advance. So, and often not taking new people, but wait for those type of injectors because it's not the material, it's really the injector. Unless, of course, if you're doing something, really not good, like not silicone droplets, but if you're injecting like an illicit, substance that's not supposed to be meant for that area, then no. But other than that, banning that, anything that's legal, it's generally the injector, not the substance that's being injected. And then as far as things that don't work, I'm a bit scared of thermage and heat devices. Maybe it's not warranted. Maybe they have their use for certain areas, but I guess I'm scared of fat melting devices. I don't know that they don't work, but yeah, I've heard from many dermatologists and surgeons that really the type of lasers, just when we're just talking about lasers, that really work are the old school ablative, CO2 lasers.
Yeah, I mean, as far as like skin resurfacing, I think lasers and chemical peels, I mean, they work. We know they work if they're used safely. They could be great. I think that's awesome for the skin. I also have concerns about these like soft tissue tightening devices, like radio frequency based or ultrasound based. I've never been super impressed by like the results, and it's always like this. It's a delicate balance because you have to appreciate the risks and complication potential of like a facelift, but you also know that there are risks of these non-surgical devices. So it's like, you don't want to subject someone to the risk of surgery if they don't really need them, but then doing all these like tightening things for like years, until you're like ready for a facelift is also, I think, problematic. Because when you go to do the surgery, you have all this like fibrosis and scarring, and it's hard to separate the layers. And I just don't think they've usually gotten that much benefit from these machines.
I'm glad you said that because I feel like there are some dermatologists on YouTube who say that you can do those procedures without fear of later complicating a facelift. And I know from my own facelift surgeon, he said that even he's opened up people, to go do a facelift on, and he said they've never smoked in their life, but they've done these procedures. And he said it's like as if it's a person who smoked for 10 to 20 years. It's the same tissue quality. And so I'm so happy to hear that that is, still the case, that it does affect that.
Yeah, very much so. I mean, even like filler, like anytime you put a needle or a cannula through the tissue, you're creating some scar tissue. And they're like tracks of scar sort of all throughout. And so with these machines, it's like a lot of heat energy that's just like frying that tissue. So it's going to produce like varying degrees of scar. And so that's because people are like, oh, but it's tightening. Like, I mean, there's no miracle here. It's tightening because of the scar tissue.
Right. Yeah.
So it's like, when you go to open up the tissues, it's much harder to work with them. So, I mean, maybe dermatologists feel that way.
Yeah.
Everyone's got like their agenda, that they're pushing. Yeah. Like it's just the way it is. So surgeons will, oftentimes go out there and say like, oh, injectables are bad. The truth is always somewhere in the middle. Yeah. And then like you have the dermatologist saying like, oh, surgery's scary. You don't need that. Just come in for your shot or your, device and you'll be fine. So it's, it's interesting. I wanted to see like, what advice would you give someone who's considering plastic surgery for the first time? Because like I have people who come in, they've never had any other procedures. But then from your perspective, I mean, what would you tell them? Maybe about, surgeon selection, maybe about just like what to ask or like, things like that.
I mean, is it a man or a woman, first of all?
Oh, you can, I don't know, if it's different per gender, you could say for each. Yeah.
Or like, like female presenting, I would say, have you tried makeup? I would honestly say that because in the last few years, the kind of advancements in beginners getting better at makeup, all of the YouTube videos available to us now, like where you can really and honestly make a change if it's facial plastic surgery to your face with makeup, I would say try that first before surgery. But if we're at like surgery's door, which I think that's kind of what your question was saying, like they've decided on surgery, nothing else, then definitely make sure your surgeon has all of the qualifications, make sure they're fully licensed. I feel like there is some good in being like double or triple board certified. Do you want to give your input on that?
Well, you keep going. I'll remember.
Okay. So that would be first all the certifications, and if that goes without saying, then I would say this is what I would do is I would ask around if anybody's had personal experiences with that doctor, because you never know. Somebody might know somebody who had something with that surgeon because I like firsthand accounts. I don't like reading online. Then I would see where do they study and where do they do their fellowship, That's important to me because whoever they fellowed under, oftentimes that surgeon, if I liked their style, say this is like a newer surgeon, not too new, but if I liked the surgeon that they learned from, I'm going to like their work usually, not always, usually. So that would be important to me. And then finally, whatever procedure I was wanting to get, I'd ask how many of them they were doing a week or a month, depending on how sort of unique the procedure was or not. So, I mean, I'll probably think of other things, but those would be my top.
And then, like, would it change if it was like a guy who was interested in a plastic surgery?
Well, obviously, if it was a guy who didn't wear makeup or anything like that, then like I couldn't address that part of it, obviously, because But no, it wouldn't change for a man. It would be the same. Yeah.
Got it. Yeah, no, and my thoughts on like choosing a surgeon, I think pedigree is very important. It's good to know like where did they come from, It's rare for someone to just like come out of the blue, like having very little formal training and like be like incredible, usually you train under someone and then you kind of maybe advance the techniques a little bit or like make it your own. I think more important than the degrees or the certifications, I mean, you want to have that as like the minimum. But I think it's what you said towards the end, which is like, how many of these procedures are they actually doing? And like, is that the focus of their practice? Because a lot of times people will do like all types of different things. And that was me up until just a few years ago, where it was like, anything somebody wanted. If it was like
Yeah.
within my wheelhouse, I could be like, great. So I'll do like a rhinoplasty today, a hair transplant tomorrow, a facelift the day after. And like, that's fine. And I think you can be very good at like all those things. I think that's possible. But I think if you're really going to be at the top of the game, that's the thing. Like a lot of surgeons don't even want to be the best. Like they're fine just being good,
Right.
good. Like they, no one wants to do things that, produces like bad outcomes or, like it leaves people unhappy. Like everyone, I think most people are trying and they're trying to do their best and like, they go to conferences and all these things. But I think to truly make it to like that next level of like,
Yeah.
no matter what the scenario is, like this person will just figure it out and likely get a great outcome for the patient. You need to be doing that procedure like maybe not every day, but probably on a weekly basis,
Yeah.
I think, and it's hard when there's like lots of different surgeries that you offer to be doing procedures consistently weekly. They
Yes.
might do it once a month. And there are rare procedures for sure where, maybe the volume just isn't there to do it weekly. Maybe you do it monthly, but like you definitely want to be doing it at that highest like potential volume. I think that, but again, that's if you want to be doing like world class, like top of the line type of procedures. And not everybody's looking for that type of doctor because generally the price will be higher. Not every surgeon wants to be that
Right.
person, or even has the ability to, because if you're in a town, let's say, that doesn't see a lot of plastic surgery patients, it might be difficult to be like that very niche, like
Right.
expert in something. And many surgeons are proud of the fact that they can do this and they can do that, and it keeps it exciting for them.
Yeah.
So they don't want to go too niche.
Yeah.
So it's very interesting, like the mentality of people who go very niche and become like the best at something versus like those who stay more broad. And it doesn't mean you won't get a great outcome with someone who's more broad. It's just that if you're looking for something specific, it, I think, helps to find someone who's doing that surgery all the time.
Yeah. And the advice I would give somebody looking for just, a general, like, I want to find a good plastic surgeon is different from the advice I'd give somebody who wants to find a good revision rhinoplasty surgeon. It's so different.
Yeah.
Yeah.
Yeah, for sure. Certain things like you want to be in the right hands for someone who's just like has a lot of experience and has just seen every different like variety of that type of surgery, because certain surgeries are really much more challenging, especially revision procedures, no matter what type of revision I think it is. If I'm doing a hair revision, it can be very challenging because you're dealing with a lot of scar tissue. You're dealing with like misplaced grafts. It's just really hard to like create a very nice, pleasing result for someone. And also there's like the element of like a little bit of PTSD for some patients, where they've kind of been hurt by maybe it was a really kind surgeon, but like just something unfortunate happened.
Yeah.
Or maybe they just didn't get along with the surgeon, whatever it is, but like something happened to them. They have a result they're not happy with. Sometimes it's very obvious that it's a kind of a, disfigured type of appearance. And there's like the psychological elements too that, you have to navigate.
Yeah. And I feel like with my new, if you don't mind me mentioning this, I have a new,
Sure.
with my new series where I talk to real plastic surgery patients and they come to me and ask for maybe more work. I deal with a lot of people who have been affected adversely with the plastic surgeon too. And I can see that there's trauma there, And so I definitely see both sides of, the patient-surgeon dynamic.
Yeah.
Yeah.
Yeah, it's complicated. I mean, because you're taking, a type of procedure that already has like a high like emotionality to it.
Yeah.
Or like, these types of cosmetic surgeries. It's like they're very emotionally tied to how people feel about themselves, how others like respond to them. And then you're putting them through a procedure where, they might have some idea of what they would look like, but you don't really know until like you see it on yourself, like whether it's your face or your body.
Yeah.
And now it's there. And now you're like, okay, like, how do I, how do I respond to that? And how are others responding? I feel like the most, the best adapted psychologically patients are the ones that don't care as much about like what others are thinking or telling them, especially in
Yeah.
the early recovery period. But the patients I've had that have been the most distraught are the ones where like some friend mentioned something and they might still be early in recovery, but then they're like, oh my God, yeah, maybe they're
Yes.
right, you know? And it's like, I'm just like, you know, just give it time. It's going to
Yeah.
change. It's going to get
Yeah.
better. But the ones where they're just like so caught up on like what some friend, sometimes a friend they haven't seen in years,
Right.
all of a
Yeah.
sudden said something and they're like totally distraught. It's not the best, but I mean, you know, people react all types of
Yeah.
ways.
And also sometimes family reacts to that person and like what they're actually kind of reacting to is just the change of that person no longer looking like the rest of them, you know? And they don't like that. You
Yeah,
know?
yeah, it's interesting. A lot of people, you know, they go into procedures they don't even tell family members sometimes, you
Yeah.
know, and then it's like, yeah, at some point they'll probably figure something out.
Yes.
And usually what I hear, fortunately, is that like there's a lot of support like
Yeah.
later on, and there's once they're healed up, it's like, oh yeah, I understand why you wanted to do that. It
Yeah.
makes sense now. But and I don't know. I mean, we're both parents. Like, if my daughter was like, "Oh, I want to get this procedure done,"
Yeah.
uh, I'd probably try to talk her out of it,
Yeah.
you know, until I
Yeah.
really understood her reasoning and then
Yeah.
help her kind of navigate that process. But
Mhm.
it's not like I'd be excited for her to want to get cosmetic
No.
surgery. I'd be like, "You're perfect. Like, why do you don't need
Yeah.
anything?" So I get it from like a family perspective.
Totally get it like that too when you put it that way. I'm like, "Oh my gosh, I would too." I would try to talk my son out of it, you know?
Yeah, yeah. And then like at some point, if they continue to feel like, hey, that this makes the most sense for me, and
Mhm.
you know, you know, if it all kind of comes together, and then they find a surgeon that they trust, then maybe it's okay. But it's
Yeah.
you know, so yes, and I think that goes back to like not rushing anything. Like from my perspective as a surgeon, when I have a patient who wants something, I really look for them to have had like plenty of time to think it over, you know?
Yeah.
So if it's something that they just recently thought of, and luckily there's at least some sort of waiting period for like
Yeah.
consultations. So it's not like they get in tomorrow and
Yeah.
surgery happens a week later. And that's, I think, a really good thing, because if you let someone just kind of rush it along, and I always feel very apprehensive when someone's like trying to get on the schedule like ASAP. I'm like,
Yeah.
this is like elective surgery. Like what? Like why? And sometimes it might be like they have some gap between jobs or something, and
Yeah.
we'll work with them. But otherwise, when I feel that kind of pressure, especially if it's a person who, you know, especially with hair, if the hair is not stable, I'm not jumping in to do a hair transplant.
Right.
So I tell them, look, we need to take time. We need to go on medical therapy, stabilize your hair loss. And if they just want to rush, no, I need to do the surgery tomorrow.
Mhm.
I'm usually like, there's something going on
Yeah.
here. It doesn't seem right. You
Yeah.
know,
Yeah. I
um,
agree.
I definitely over time like that those antennas have gotten very sensitive,
Yeah.
because you just don't want to put the wrong person through the wrong procedure, you know, because it's like then you're dealing with a whole other potential mess, uh,
Yes.
you know, and you feel bad for the person, but then you feel bad for yourself sometimes and your team, because the
Yeah.
team is involved too. It's like,
Yeah.
that's the other thing. It's like not just me and the patient, it's the whole team. So if a patient's unhappy, post-op, let's say, sometimes pre-op, but you know, we try
Yeah.
not to operate on those. But let's say post-op, you know, the whole team feels it, you know,
Yeah, of
and like
course.
we're in this. I think I speak for most of my team members that there's like passion to the work.
Yeah.
It's not just like I'm going to come in, make some money, fine.
Yeah.
Like there's a lot of things you can do to do
Right.
that, but it's like everyone wants like people to be happy and like, you know, say great things about the
Of
practice, about
course.
their experience, to thank everybody, you know. But when someone's like unhappy, it's just like the whole mood just, and we
Yeah.
have so few of those patients that like you feel it's always just palpable. It's like, oh my
Right.
God, this like person hates us. And then like everyone's in a bad mood. No one wants to pick up the
Mhm.
phone and talk to that
Yeah.
unhappy person. I mean, we do, but like you don't feel good about that.
Yeah.
And we always think like, what could we have done to like, you know, and the crazy thing that I've found is that like some of my least happy patients from over the years have had some of the objectively like best outcomes,
Yeah.
and which is it's a weird
Yeah.
thing to
Yeah.
say, but
Yeah.
it's kind of true. Uh, and that's just, I don't know, it's been the truth. Like the people who've actually had real complications, like an infection or some little nerve palsy, luckily temporary, but you know, things that can happen. Um, have been some of the most understanding, like awesome people. And it's like
Hmm.
they actually had like a problem that sometimes affected like the
Right.
final
Yeah.
cosmetic outcome. But like you work with them, you make it better, you adjust things. So, which again goes back to like what I said previously. I think if it's a reasonable person, and of course a reasonable surgical team, because you got
Hmm.
teams that are maybe they don't want to work with you if you're unhappy or whatever. But like then you can figure like literally everything out.
Yeah.
I feel like if you have
Yeah.
an experienced like surgical team and a patient who's like just wants like a nice outcome, but it's like those dynamics of people maybe not knowing what they're getting themselves into, or
Hmm.
a surgical team that shies away from problems or doesn't want to deal
Yeah.
with them. That's when you have problems.
I agree with you completely. Yeah.
So, in terms of like the future of plastic surgery, do you see any interesting like techniques or technologies that, or even just like the way the society's thinking or
Hmm.
might be thinking in the future that seem interesting or that might change, or any predictions?
I mean, I remember one of my surgeons, I believe it was Dr. Martin, said that we're headed towards like more of a scarless surgery when they start figuring out how to, I don't want to say create skin, but it's something along those lines. They're currently working on advancements. So there's not as much scar tissue, and that we're headed towards like more of a scarless surgery, which is mind blowing,
Mm-hmm.
you know?
Yeah, I mean, scarring is interesting. I mean, even now, there's ways of really minimizing scars, but like
Hmm.
it comes down to reducing the tension on closures. And we've
Yeah.
seen those like really crazy like facelift scars,
Right.
where it's
Yeah.
like things are pulled so tight
Yeah.
and it just stretches everything out. So even now, so like I think even in the future when we have these new maybe technologies, like yeah, definitely read about a bunch of them. Um, Even then, like you're not going to be saved on the surgical side or from a patient's
Hmm.
perspective, like just I think relying on those things. I
Right.
think you still need like good, solid like surgical technique. And then maybe on top of that, if you layer on this like
Hmm.
cool advancements, then maybe like the scars are like almost invisible.
That's amazing. Yeah.
But I think just relying on that and like doing, subpar
Hmm.
surgery
Yeah. I hope.
is
Yeah.
like
Yeah.
it's
I hope
not
not.
it's not gonna look right.
Right. Yeah.
Um, for sure. And then like I find that, and this is what I look for in doing the celebrity analyses when it comes to like
Mhm.
facelifting, like I'm looking for actual changes in the hair,
Yeah,
you
that's
know,
great. Yeah.
and I wonder if more and more people will be like, oh, wait, I did lose hair there because of my lift. Like
Yeah.
maybe I should get like, if they're
Oh,
looking to be
totally.
not recognizable, like from a
Totally. Yeah.
surgery's perspective. Yeah.
Yeah. And I'm really shocked sometimes because there's certain celebrities and like entertainers who don't take care of the hair scars. I'm like, that's so weird. It should have been done like, more detailed work as far as like, okay, let's put some hair there where I've lost it,
Yeah.
if it's not growing back.
Yeah, it could be a dead giveaway. And then something
Hmm.
else I've noticed for facelifting is like the tragus really changes.
Totally.
It just
Yeah.
kind of like looks like a pancake. I
Yeah.
feel
Yeah. It
like,
flattens out.
yeah,
Yeah.
it just flattens out. It's
Yeah.
very difficult to fully recreate. You're bringing in all this tissue, and even if you thin out that tissue as you're like draping it over and suturing, it still just is different. And so I don't know if maybe people come up with interesting ways, but I think once you mess with the natural tragus, it's just
Hmm.
like hard to get it back.
I've seen it injected with hyaluronic filler here by like a really talented dermatologist out here, and it looks really good. But
Hmm.
I mean, how many people are going to do that?
Yeah.
Celebrities might though.
Yeah,
Yeah.
that's true. And then this is kind of like this hypothetical
Hmm.
question.
Yeah.
And I know maybe it's like a weird way of thinking about it. Like if it was possible to, reverse the clock and like
Hmm.
not have aesthetic plastic surgery, do you think the world would be a better place if it didn't exist?
I don't think the world would necessarily be a better place. I just think that it's good that people who want to improve aesthetically can, and that it kind of levels the playing field for a lot of people.
Yeah, like I was thinking about that, but I think there's still, an access,
Hmm.
issue. Like I think there's places all around the world that offer, these services, and people are flying, for medical
Yeah.
tourism, and they're getting all types of things done. And so I do agree with you that like you can always get it done somewhere, fly to like the cheapest place. Most people I think can kind of afford it somewhere, but you have like a big separation of, I think, skill and talent and, different protocols for recovery that some people have access to, others don't. So it's still like, the people who have more resources getting things done better than the rest, for the most part. So yeah, so I don't know. I wonder about that, because like, are we chasing something, and then the people with more, abilities, resources, financial abilities are getting it, and then being able to push their careers or their whatever agenda further, and then the rest, like, not being as fortunate. I don't know.
I
It's just
mean,
a
I
thought
don't
had.
know. I get what you're saying, but I think like when you asked me the question of like, if we never had plastic surgery, I just meant like in a general sense, like, the concept of plastic surgery, I don't think it's a bad thing, but then when we get into like logistics of like who can afford it and who, what people have to go, to subpar surgeons, but then we can also go into like, okay, well, who was born with really great genetics, who just, they can get to where they want to go with just a nose job, and really like maybe that's the only thing that, is quote unquote wrong with their face. So like, is it really fair that people with better genetics can go further? Just, maybe they need less procedures. We could get so wrapped up in all that, and, it's kind of like we have to talk generally, because in general, I think it's good. Plastic surgery, the concept of it has been pretty good for people overall.
Yeah. Yeah. I think, and we didn't really even touch on like people who have, clear distortions in how they think about this
That's
stuff,
true.
like
Yeah.
the body dysmorphic disorders, and the people who are chasing some, ideal or perfection that will never be there.
Yeah.
So, I mean, that I don't really get those patients in my practice too often, fortunately, where like I can just see that that's what's happening, and I tell them no, or, in the nicest way possible.
Yeah.
But I think like the people who have body dysmorphic disorder, for example, are out there. And I think it comes down to, being aware of that. I think from some patients may not have that insight, but at least for surgeons, they need to know that they need to be careful, because those are people you can never fully please.
Yeah.
And they're hurting themselves, I think. So I don't know if you've had any experience with, I know you're doing like the conversations with people who've had surgery. Have you met any where you're like, this person clearly has something that's a bit off?
Yeah. I mean, there's definitely been some people who even kind of like self-admitted that they feel like they have dysmorphia around a certain maybe body part, right? So it's tough nowadays, though, because a lot of just regular people have it who wouldn't have had it because of social media, and comparing themselves to that, to filters of themselves. So, yeah, I mean, I think it's more prevalent now than ever. I think somebody with like true dysmorphia probably has learned how to hide it from surgeons. Like they could probably say the right thing so it doesn't raise a red flag, but then I think that it still will show itself at some point, maybe afterwards when they want something changed about what you just did for them. There's definitely people like that. Yeah.
It can be hard to know when to cut someone off.
Yeah.
It's almost like someone's at the bar and they're asking for another drink. Like it's good for the business, for the bar, that someone's coming in for drinks.
Yeah.
And maybe they can really tolerate the alcohol quite well. So it's like, okay, give them a third drink, a fourth drink, a fifth drink, and maybe they're starting to slur their speech or act a little bit, silly. Or maybe they're starting to bother some other patrons, but like kind of knowing when to kind of cut them off as a bartender. I mean, not that I have any experience in that, but I would imagine it's like a similar thing, and being like, look, this is for your good and also the good of those around you. That like, that's it, like no more, at least for now. So it's I don't know. It's kind of like that where like you need to know when and it's not so obvious. And like the person, right, the drinker in the bar might get upset. Like, oh,
Yeah.
well, what do you mean? Like I'm
Yeah.
here, I'm paying you, like get
Mhm.
me another drink. That's what I'm at the bar for.
Yeah.
That's like I think it's like that sometimes with plastic surgery too.
Yeah, and, like, with my consultations, I've been I used to, I still sometimes do, I'll ask them to show me a picture of what they'd like to look like, and then I look at and I say, "You can do more than one person." It could be anyone, it doesn't have to be a celebrity. But if it's too far off from what they look like, that's usually, like, a hint to me because, like, if it's really far off, then we have to talk, as far as, like, do you think this is achievable? I ask them that. And if they do, I tell them what's achievable. Like, you know, you
Yeah.
can only do certain things. You can't move eyes. You can't change like the vertical length of the nose. You really can't. Like as far as like the whole of the nose, you can't change without, like a Lefort 3, which I don't think any surgeon's doing for aesthetics. Like you can't change how far apart your eyes are or how close they are together. So I tell them that.
Do you think in cases like that, going to therapy is something that actually
Hmm.
helps? Because I mean, yeah, people say, "Oh, we should send them to therapy," but the question is therapy going to help them?
I think therapy, the right therapist could help them.
Hmm.
Yeah, because it's usually so deep seated, like
Yeah,
family origins.
yeah. Why they just dislike how they look completely?
Yeah, it's usually not even their fault, honestly. So a lot of people have been telling me to look at certain celebrities' faces, and they're kind of hinting that maybe it's not plastic surgery, maybe it's more of like Ozempic use. And I'm kind of over here like, yeah, I know it affects the face, but how do you specifically think it affects the face, doctor?
Ozempic leads to fat loss, and when we experience fat loss in the face, everything just looks more gaunt and almost more sunken in and starts to sag more. So, especially I think around the eyes is where we're really seeing that impact. And we don't often think about the fat around our eyes, but as we lose that, it kind of creates that sunken in appearance and it just creates that hollowing that ages people and just makes people look in many ways less healthy.
Do you think that's happening specifically from Ozempic use because of how rapid people lose the weight?
Yeah, I think it has to do with how quickly they lose it, but I think it might also be something more specific to the actual set of medications that I think no one's really parsed out completely because people lose fat because sometimes they just exercise more
Right.
or they had some major bariatric surgery
Right.
where they start to lose weight like that doesn't often lead to such extreme facial changes. So there could be something related to the distribution of the fat loss with these drugs that we're still figuring out. But for sure, they have this like characteristic type of look. All these different celebrities and non-celebrities who are on these GLP-1 agonists.
Yeah, I agree with you because there was some sort of document that I read that came out that said that the actual weight loss from the GLP-1 agonists is a lot of tissue, like, you know, and it didn't specify what kind, but I have to think it's collagen, elastin, um, other things besides fat. Of course, there was fat loss, but a lot of it was muscle, collagen, elastin.
There's just
Yeah,
almost like an overall like wasting away, like an
right.
atrophy, and people are looking almost sickly.
Yeah,
So yeah, they're losing a ton of weight on it. It works for that, but then the effects on the face are pretty drastic.
yeah,
More extreme than what we've seen with um, other types of weight loss programs in recent times.
yeah. I agree with you. And I think, well, maybe keeping their protein up may diminish some of that, but I'm sure that, well, I'm not sure, but I think that some people who are taking them, GLP-1 agonists, who are not taking it for example, pre-diabetes or diabetes, they may be not thinking about replacing the protein that they're missing in their diet.
Yeah, yeah, it could be. Yeah, it could be just
Mm.
some dietary adjustments that they have to make now that they're on these medications that
Yeah.
I'm not sure about. But surely it's not looking great. It's
Yeah.
not just about, being, I think, skinnier. It's
Right.
about overall looking healthy. And it's kind of working against a lot of people. So
Yeah.
we'll see. We'll see where that trend goes.
Are you seeing patients in your office who have been on these medicines and there's been that fallout to their face?
Nowadays, since I focus the practice just on, hair and lip surgery,
Hmm.
I don't really have too many patients who come in for like an overall kind of facial
Yeah.
wasting and, help me figure out a plan and do I need a
Yeah.
lift and all this stuff. It's just since I've moved away from some of those procedures, but I know that many of my colleagues are, seeing like a influx of patients with those types of concerns. And then there are some problems with putting people to sleep for plastic surgery
Mm,
when they're on these medications because it delays the emptying of the stomach.
yeah.
And so if you're getting anesthesia, that can increase your risk for like aspiration, and that makes it less safe. So you have to be off of these medications for a few weeks usually. So
Yeah.
that's something that people have started to realize. I would say within the last year,
Hmm.
because there were some situations where, people had like an aspiration episode when they were being intubated, and
Oh,
then it turns out they're on these
oh
medications.
my gosh.
So
That's
just
really
yet another thing
scary.
that you have to be careful of
Yeah.
in the kind of preoperative, kind of intraoperative setting.
Hmm.
Great.
Okay.
Thanks, Laurie. This is
Awesome.
so cool.
That was fun.
Yeah.